I, like you, never pictured my graduation like this. A planner by nature, I had it all mapped out. My family would drive into town, my graduation cap would be decorated with something punny, and my spray tan would be fresh from the day before. Unfortunately, sometimes when we think we have it all figured out, something happens that humbles us. We are made to realize what we can and cannot control, and these feelings of uncertainty make us feel a little uneasy. Good morning, or good afternoon, maybe good evening. My name is Ashley Rapp, and I am graduating with my MPH in Epidemiology. I wasn't ready for what I later found out to be the last time I was to ever meet with my classes. I wasn't ready to be plunged into a new normal months sooner than I had expected. However, I do wonder if we can ever be totally prepared for life-altering moments like this. In fact, the situation makes me think of my own family and how they weren't completely ready for their big moments either. My Nana and Baba weren't ready when they immigrated to America from Iraq with very little English, little money, and not a perfectly clear plan, just the dream of giving their family a better life. My late Grams and Opa, after building their family farm from the ground up, weren't ready to lose their land and everything that they had built. All they could do, my grandma said, was trust that God had a bigger plan. My parents, my mom and dad, ever since I can remember, worked midnights, extra shifts, getting multiple jobs, sacrificing everything to ensure that my sisters and I had every opportunity imaginable. They pushed us constantly to dream bigger, love harder, and work smarter, leading each of us to accomplish goals that we could have never imagined as kids. Despite each of them feeling pretty unprepared, my Nana, Baba, Opa, Grams, Mom, and Dad have each taken these moments, these unsuspecting times of uncertainty, to craft a vision. A vision not only for themselves, but a vision for the world. I've always understood the responsibility that accompanies their legacy. Growing up, I dreamed of being just like them, resilient, tenacious, purpose-driven, but I struggled to find something that I was passionate about, somewhere that I fit in. I searched and I searched, but it felt like I was coming up empty each and every time. It wasn't that I was apathetic. I just wanted to find something that sparked something more in me. 3 years ago, however, I found it. And I found it in a communal bathroom. Now, I understand that not a lot of people have had a life-changing experience in a public restroom, so let me explain. I was an undergrad. I was fixing my makeup in the mirror when someone behind me asked for a tampon. Thinking nothing of it, I gave her one from my backpack. A week later, I saw her again around campus, and this is when I found out that she, like 47% of college students, was food insecure and in turn struggled to afford menstrual products. She thanked me for helping her out of a tough spot. She hadn't been able to really afford products for months, and she felt ashamed to ask for help. Our encounter launched me into action, and ultimately, my action and advocacy are what led me to Michigan Public Health. At SPH, I discovered the best network of support that a student could ask for. My classmates, the faculty I met, and of course our student services staff supported what I was passionate about and encouraged me to develop it even further. And so my work on menstrual equity became more than just a passion project. I worked with a team to put on a nationwide rally. I gave testimony before the Michigan legislature earlier this year. I founded a group on campus committed to making menstrual products accessible, not only at the university level, but throughout the entire state of Michigan. To me, these accomplishments defined my time at SPH. They were the product of collaborations between like-minded allies. They changed minds, opened hearts, built awareness and partnerships, all because of something as simple as someone needing a tampon. And to me, that's the magic of this place. That's the magic of SPH and of all of you listening today, is this ability to not only craft a vision and put something together, but to actualize it. Today, though we may be feeling both excited to start a new chapter and maybe a little worried about what's to come, I think it's important to reflect on how we all came to public health. For some of us, we experienced firsthand the very inequities that we're working to solve. For me, it was that bathroom. And for you, it might have been a desire to explore the sciences through research, or maybe a past personal injury, family illness, the list goes on and on. But though we all have different reasons for pursuing public health, I believe that we all share the same destiny. We, the groundbreakers, problem solvers, and change makers, are relentless in our pursuit of a future that belongs to everyone and works for everyone, especially the most vulnerable. I've seen it in you, my classmates, doing amazing things like conducting evaluations for American Indian Health and Family Services, chairing the Ann Arbor Out of the Darkness Walk, putting on community events like Dia de los Muertos, and interning in Jerusalem at the Israel Ministry of Health. We, the graduates of 2020, will create a happier, healthier world for all. And sure, it seems like the world is changing around us, like even much faster than we can keep up with, but by no means should we stop planning, setting goals, and working toward them. I just believe that the way we respond to adversity is just as important as how we plan for prosperity. It's no coincidence that we are graduating with degrees in public health at this very moment. Just as those who came before me found their vocation, their purpose, at a time when they weren't quite ready for what was to come, I know in my heart that we too are ready for what's next. We are ready to do something monumental. Thank you. Congratulations to the class of 2020, and go blue.